Competency is not just a buzzword. To us, it is a requirement for your care. Innovation is our mission. Commitment for your care is our foundation.
A rehab center in South Georgia is offering a new state-of-the-art therapy. A new aquatic therapy program at Innovative Rehab Solutions in Valdosta allows patients who suffered strokes or have arthritis or body pain to use an underwater treadmill. Underwater, it's easier for the body to relearn movements.
All of them indicate after a short while that they start feeling better. Then the next thing that they start usually even volunteering to say is like, I'm starting to do more around the house. I'm able to do better, do more.
Our aquatic therapy is designed with underwater treadmill technology, which can treat any patient with balance or movement problem or anyone having joint or muscle pain. Aquatic therapy has also been proven to lessen the effects you feel with arthritic pain, chronic pain, fibromyalgia, post-surgery injuries, and many other health conditions. Aquatic therapy has lasting effects on the body, and the movement underwater has the ability to improve balance, coordination, and motor skills without stress. Sensory stimulation in water increases kinesthetic awareness of the body.
People who've suffered from strokes and other trauma now have a new option in treatment.
A rehab center in Valdosta offers state-of-the-art therapy, and its success rate is astounding. WALB News 10's Alicia Eakin has details.
May Elmore has suffered from infantile paralysis since her first birthday and has been wheelchair-bound for 5 years. Since she started therapy at Innovative Rehab Solutions, she's relearned to walk.
She can get up and down, and she can stand up and walk on that treadmill in the pool, which she couldn't do before, and they've just done a wonderful job.
May is just one of the many patients who have come to Innovative Rehab to use its newest technology, the Aquatic Therapy Program. This therapy allows patients who suffer from major pains and arthritis to enter the pool and use the underwater treadmill. And with some simple exercises, therapists can then train the brain to relearn movements lost by traumas suffered. On February 15th, Doris Warren suffered a massive stroke that left her partially paralyzed.
I couldn't move my left arm at all, and I'm left-handed.
Since then, she's tried many rehab programs with no success. That is, until she heard about Innovative Rehab Solutions and started their underwater program.
I went to rehab in the hospital, and then I also had rehab at home. But we just didn't seem to make any progress. And we have here.
Innovative Rehab has been here about 3.5 years now. And I can truthfully say they're the best therapy service we have had in my facility. We've had strokes who were unable to walk, and they came in, and of course their doctor ordered therapy. And Innovative Rehab, in working with them and the residents' willingness to work with them, they eventually began to walk and got well enough to go back home. They come in and they're unable to do anything for themselves, and through therapy they begin to be able to feed themselves again or to walk. Even with the assistance of a walker, in some cases, is a great motivator for them because they're up and moving. It just makes the world of difference in their mental attitude toward life.
My name is Cheryl Wilkerson, and 15 years ago I was diagnosed with multiple sclerosis. I've had several bouts with not being able to walk. During this time, I went to therapy. As the therapy worked with me, I got more and more able to walk. I came from not being able to stand on my feet to be able to walk anywhere I want to go. Well, when I started to walk, I couldn't believe it. It just happened like a change overnight. It's really fun. It's hard work. Believe me, you have to put every ounce of energy into it. But if you do, you get every ounce of worth out of it. And it's worth every bit of it. Then they follow you and they guide you, and they're there with you every step of the way with encouraging words and actions.
When I first come here, I couldn't do nothing for myself. Not nothing. I couldn't get out of bed by myself. I couldn't hardly stand up by myself. So I got with the good therapy people right here that had me stood up. I got up out the bed Saturday morning on my good leg and got out the chair by myself, no help. They real nice to me, and I like working with them.
VitalStim is an FDA-cleared procedure that we can use now to treat patients with dysphagia. It helps stimulate the muscles in the neck so that they can eat, swallow, drink liquids, things that they haven't been able to do. Dysphagia is a swallowing disorder that's caused by stroke, cancer, Parkinson's disease, various things. Usually you'll start noticing a result between 12 to 15 visits. Patients who are on feeding tubes are also candidates for this treatment.
Our treatment focuses on the entire person instead of just the back pain, knee pain, or paralysis. Most importantly, factors such as depression, fear, and anxiety affect each patient's life differently, so we never use a blanket approach for all back pain or all stroke patients. We focus to see how the brain can relearn movement. Traditional treatment teaches patients exercise, where we focus on the movement. Researchers are finding that exercising a stroke patient could actually hinder their progress of walking or performing the activities of daily living. Your goal, our passion. Visit us on the web at www.irehab.net.